All right, we're gonna get started with our live. Hope everyone's doing well. Let's see. All right, perfect. We're gonna get situated here. Okay, let's see this side. I am on TikTok, Instagram, YouTube. So we're getting set here. There we go. There we go. You're gonna get set here. Perfect. All right. Hope everyone's had a wonderful week. Great. There we go. We're going to give it a minute for everybody to join on. So when that happens, I'm just going to talk a little bit about me. I'm a board certified plastic surgeon. I'm in Los Angeles and Miami. My big procedures are rhinoplasties, breast augmentations, and BBLs. Those are my top three procedures. But I do a little bit of everything. So this is a forum for everybody to kind of join on. And I do this every Wednesday from 1 to 2 p.m. Pacific Standard Time. Just to, give you guys some education, answer questions that you guys might have. If you guys are thinking about doing plastic surgery, but not ready to pull the trigger to go see a consultation yet, but just had some questions, that's what I'm here for. Again, just to help give you some advice. Obviously, there's a lot of stuff online, Google, ChatGPT that you can ask that maybe not be 100% accurate. And I like to do this so you guys can meet me. I can meet you guys and kind of get to know each other a little bit. But most importantly, that link tree in my profile. So I am on Instagram, TikTok, and YouTube at the same time. The link tree in my profile has a lot of links and information on there. It's got my both of my Instagrams on there, my regular one and my before and after Instagram page for those of you that are looking to see kind of a results page. So I have a ton of those on there and posting a new one every day. We also have my YouTube that has a lot of educational and consultation videos on there, as well as some funny stuff for TikTok. So please click on that link and follow me, and then you'll be able to kind of keep up to date with kind of the new things out there. So all right, we got some questions coming in already. How long is a total drop and fluff process? About 3 to 6 months, depending on how big the implants are. The bigger the implant, the longer it's going to take. The smaller the implant, the less it's going to take. Hey, Doc. Hi, Diamond. Thanks for joining. Good to see you. Hope you're doing well. Okay, great. Give it another minute. Thank you. My pleasure, Lorraine. Again, all my social media channels are Dr. Roger Tsai. Again, I got a lot of information on that link tree above. You can also schedule a complimentary video conference with me on that link tree above as well. So we can chat. You can schedule into my actual schedule. We can have a conversation, speak specifically about your particular situation and things like that. So that link is there for you guys to get on and see some more things and see some videos about things that I've created and see some before and afters of patients that have done, some testimonials and things like that, okay? Is 65 too old for mommy makeover in your opinion? Absolutely not at all, Kate. Not at all. It's not too old. For me, age is just a number. The biggest thing here is, are you safe and healthy to get a procedure done? And so for a 65-year-old, there's some extra testing that we need to do, such as a cardiac clearance or x-rays, EKGs, things like that, just to make sure that your heart and your body is healthy enough to have general anesthesia and surgery. But as long as you pass those tests, and again, we'll send you to a doctor to get all that taken care of. Absolutely not. I mean, I've done surgery on 60-year-olds. I've done surgery on 70-year-olds before. So no, it's absolutely not too late. Again, as long as you're healthy and so on and so forth. No meds, oh, even better. It sounds like you're a very, very healthy 65-year-old. So I'm glad to hear that. No, age is just a number. It really just depends on your internal health, if that makes sense. So no, 65 is not bad at all. Especially for a mommy makeover, I understand that's a big procedure also. Not a big deal. A lot of people are starting their second lives at 65, so it's great. But no, again, Kate, if you want to have a conversation and chat with me some more, click that link tree in my profile, schedule a consultation with me. You can also DM me or call my office. It's all information's on my profile as well, okay? Got a BBL AirSculpt 9 months ago. I look exactly the same, very disappointed. So Ashley, a lot of people ask me about, so AirSculpt is awake lipo, okay? I had a conversation this morning on a patient that wanted me to do a lipo 360 BBL on her, and she asked me if I do this awake. And I say no. This is the exact reason I say no, because when you do lipo awake, number one, you can't get as aggressive. You're not gonna get the same results as you're asleep, because guess what happens? It hurts. It's a painful procedure. I mean, liposuction is a rod going in and out. It hurts. you can only numb so much. So number one, you're not going to get the same results as if you were to go to sleep. So the surgeon can get more aggressive if you're asleep. So with AirSculpt, the concept is great. You don't have to be asleep, this and that, but you're wasting your money, you're wasting your time, you're going through recovery to look exactly the same as you mentioned, Ashley. So I'm not a big fan of AirSculpt, only because there's only so much you can do. And again, it's a marketing tool. You don't have to go to sleep. Oh, it sounds amazing, but the results aren't the same at the end of the day. So unfortunately, I'm sorry that you had to go through that, but you know, there's a reason most people do lipo asleep is because you can get more aggressive. When there's only a small subset of doctors doing something, you gotta be weary. There's always an ulterior motive there, okay? Over the muscle for rounded rib cage. Not necessarily. I still think under the muscle is the best regardless with any situation. The only situation I would maybe recommend going above the muscle is if you're a bodybuilder and you do competitions and you can't really have distorted, when you're crunching your chest or anything like that, you can't have any distortion. So that's the only kind of situation I would recommend going above the muscle, but pretty much rounded rib cage, more coverage, all that stuff below the muscle is the best way to go. Do you prefer faja or a waistband after a tummy tuck with muscle repair? With just a tummy tuck, just a waistband is fine. The faja you don't really need, unless you're doing a BBL or anything like that. But just a waistband is more than enough for a tummy tuck with muscle repair. What is involved with neck tight? So neck tight is you're probably talking about face tight. It's called face tight, not neck tight. But basically, it's a device that goes. It's a needle that goes in, and there's a device on the outside, and I guess there's some kind of magnetic radio frequency kind of treatment that tightens the skin. So that's basically all there is to it. Hello, hi Jamie Lee, thanks for joining. Okay. She said she could only get 2 liters. She didn't tell me I was too small before she did. Well, that's another thing. I tell patients oftentimes that the way I approach surgery, and I say no to patients all the time, okay? So the way I tell patients is, hey, listen, this is all we can get from you. If you want to do this procedure, just do understand that it's going to be minimal results. She should have probably said that to you, okay? Unfortunately, again, it's still a business at the end of the day, right? Some doctors are more scrupulous than others. Some doctors are more honest than others. For better or for worse, I'm a little too honest to the point where sometimes I turn patients away, right? So for example, if you came to see me, you didn't have a lot of fat, I would have been like, it's probably not worth doing. Now, I could have said, yes, let's do it, and made some money, but that's not who I am. So it's important to see a doctor that tells you no, right? And so, unfortunately, this is kind of what happens when you go through that. Hello, thanks for joining. Let's see. Thoughts on internal mesh? Great question, Lisette. So it's a great procedure for the right patient. So I personally only do internal mesh for 2 reasons. Number one, if it's a very, very large implant, and the patient's bottoming out, or it's a removal or replace, like a patient that's redoing the breast, and the implant's bottoming out, and they go bigger with an implant. That's one scenario I'll do an internal mesh because they need that support to hold that heavy implant up. Number 2 would be somebody who doesn't have very strong skin envelope or very good support. For example, patients who've lost a lot of weight, or patients who've breastfed and had multiple kids, and their breasts are just a little bit saggy and the skin's just not very firm or toned, and they need that extra support. Then I would do an internal mesh. So those are only 2 reasons I would ever do an internal mesh. Otherwise, there's no point in doing it. It's extra money. You don't need it, for a primary augmentation, or like doing a small implant that you need to do an internal lift on. So again, very big implant that doesn't have good support, or the skin quality is just terrible. Dr. Roger, I need your advice now. What is it that I can help you there, TTX? Where are you located? I'm in Los Angeles, California, but I do spend a week out in Miami every month. So bi-coastal. Just followed you. Oh, thanks. Where are you located? Hollywood, California. Yes. Thank you very much, Leandra. Can endoscopic temporal and mid-faceless be reversed? That I don't know, since I don't do those procedures. It depends on what kind of stitches they put in. Possibly, yeah. Everything's reversible and redoable for the most part. It just depends on how it's done. I recently had a tummy tuck muscle repair. I'm showing swelling after drains were removed. You gotta go talk to your doctor. You possibly could have a seroma if it happened after the drains were removed. So I would go see your doctor ASAP. What's best for double chin? Lipo or Kybella? If it's moderate to severe, you're definitely gonna need lipo. If it's very, very mild, you can get away with Kybella, which are injections. and it's not going down. Okay, answer that. Can a Becker muscular dystrophy carrier receive Botox? I don't know. That I don't know about. I have to look that up. Sorry. Does internal mesh help with mastectomy support? Yes, because you don't have that. Again, when the breast tissue's been removed, that skin quality is probably not the best, right? There's not a lot of support to that tissue. So yes, it can, but again, it also depends on how large you're going with the implant, right? If you're going small with the implant, 200-300, there's no point. If you're going large with the implant, 600-700-800 or so, then sure, yeah, it can definitely help. I'm bottoming out but cannot afford replacement right now. Am I safe until I can? Yeah, bottoming out just doesn't look good. Nothing bad's gonna happen. It's not gonna harm your health or anything like that. It just doesn't look good. So yeah, you can wait until you have the finances to afford that, unfortunately. Thoughts on BII? I think it's a thing. I like to give patients the benefit of the doubt. I know a lot of surgeons and doctors don't believe in it, but I personally believe there's something there. I've had a lot of patients come in with breast implant illness and had implants taken out, and they feel a lot better. So I feel like there's some component to it. It's an autoimmune disease, for those of you that don't know, that it has to do with breast implants, your body kind of fighting itself and causing a lot of autoimmune issues. So it's non-specific. It can happen, something definitely to know about, but it's also very rare. How much would a change of breast augmentation charge for a breast augmentation in practice? So I think it's $12,000 for a primary augmentation. So I mean, like the first time around implants. Do you do drainless tummy tucks? No, I don't do drainless tummy tucks, and there's a specific reason why. If you've been listening for the last 5 minutes, there's somebody on here that said they just got a tummy tuck, the drains were removed, and now they have a lot of swelling. Again, that shows me that she probably has a seroma that's forming. I would say the 50% chance that you're going to get a seroma development if you do drainless tummy tucks, and the only way to take care of it is to go into the office once or twice a week, or maybe even 3 times a week, to get it drained and removed with a needle. So I don't think it's very wise to do it because the risks of having seromas are significantly higher. The drains are only in there for a week. So a week versus having to come into the office to keep draining it multiple times a week for maybe multiple weeks at a time is not worth it to me at the end of the day. Thank you. My pleasure, Holly. Oh, plastic surgery. Thanks for joining. Appreciate the support and the love there. Does upper bleph work for hollowness or only bags? Clinics say PR wouldn't help because my face flat. So a bleph would work for only the extra skin or the bags. So sorry, it's the skin or the bags. So hollowness, you would need, I wouldn't, if I were you, if you're getting a bleph done already, I would do fat grafting. Take some fat. If you have some hollowness there already, you probably have some hollowness in the cheeks. So I do some fat grafting. Take some fat, fill in the what we call the tear trough area, fill in the upper cheek, lower eyelid region to give you more fullness, give you that apple fullness and appearance, and that'll help with the hollowness. Some doctors take the fat from the bags and reposition it to help with the hollowness. So no, not necessarily. I mean, it can help with the blepharoplasty can help with the hollowness. What would you say is your favorite surgery to do? I do a lot of rhinoplasties and breast augmentations. I guess I'm known more for that, but I like breast surgery. Can you speak to the new larger sizes that Mentor is now offering? So they are offering a 1450, I believe, but it's only used for reconstructive aspects. It's not meant to be used for cosmetic. Now, could you? Sure, you absolutely could, but it's made for reconstructive purposes. The reason is oftentimes, especially with bigger patients, if they've had a mastectomy, they have 0 breasts. And so they need extra cc's in order to get their breasts back to even normalcy, not even talking about an augmentation. So it's made for reconstructive aspects, not for the cosmetic world. Okay, I've had my implants since 1993. Should I have them removed? No, if you're not having any issues with them, if you still like how they look, you don't have a capsular contracture, they're not ruptured or anything like that, leave them alone. Is fat grafting long lasting? It's very, very long lasting. It's pretty much permanent. You can't ever say anything super permanent, but it's pretty much as permanent as it gets. Does fat grafting on upper eyelids go away over time? What's the best way to maintain it? Keep your dietary and exercise habits. It's fat, right? And so if you're doing anything to burn fat, it's going to go away. If you do anything to gain fat, it's going to come back. So it's going to ebb and flow and be dynamic with your body changes. Is diastasis recti required surgery to fix? Yes. Only way to fix diastasis recti is with surgery. How much would that be with you? LMA, what procedure are you talking about? I have lots of questions here. I'm talking about different procedures every time. So you're going to have to tell me what procedure you're interested in. What procedure can be used for excessive cellulite in glutes? Sulfina and Avli are two procedures that works very well for cellulite. Had a rhino 2 weeks ago and can't move my upper lip or smile. Is that normal? It might take a little bit longer for that to occur. Yes, you're probably very swollen and tight. Can mastectomy support larger implants? Seems so delicate. Sure, it definitely can, which is why somebody else kind of asked me if they did that internal mesh, can that provide more support? So yes, in a situation like a mastectomy, I might look into that. But again, I don't do any reconstruction, so that's a little bit outside of my field. But yes, you can, if you get a mesh placed in there, it'll definitely give you more support. Thank you. My pleasure, Coco. Would you be willing to do free surgery if I let you film it? I don't have any means to be able to do that. I'd have to spend money to do it for you. So no, I have plenty of surgeries that we can film that patients pay for. So that doesn't, that doesn't pay the bills exactly. I would be paying to do your surgery, which nobody's going to pay to do anybody's surgeries, unfortunately. I'm sure you wouldn't work for free either. Dan, you're so knowledgeable and fast. Thanks for answering my question. My pleasure, Hoka. I need to have an open septorhinoplasty, but would like reconstructive as well. Do you take insurance? I don't take insurance, but you can run the procedure through your insurance company and they might give you some money back. There's no promises with that, but we don't take any insurance. We're totally cash pay, out of network, and all the above. The under eye fat grafting for Hollanders, or what do you recommend? How much would it be? So LMA, it would depend, because if you need under eye fat grafting, you might need a bleph as well. Like, do you need a blepharoplasty? Do we need to take the fat pad out of the eyes? Do we need to take out loose skin? There's a lot of things that is difficult to address. If you're talking just fat grafting, that's probably like $4 or $5 grand. Now if you're talking about a blepharoplasty where we take the skin out, or taking the fat pads out, we're probably talking 8 to 10, something like that. So it's hard to say. We would need to schedule a consultation. So LMA, if you want to click that link in my link tree above in the profile. In my profile, you can contact me many different ways, but in the profile, there's a link tree there. Click on that. You can schedule a consultation with me. We can chat some more. After we do a consult, we can give you a very accurate quote, depending on exactly what you need. But lower eyelids sometimes are tricky because it could be fat grafting, it could be skin, it could be fat, it could be the fat pads, it could be 1 or 3. It just really depends on what it is that we need to do for you specifically. How do you feel about chin implants? I think they're great. I do them all the time. There's nothing wrong with it. I've been leaning more towards fat grafting these days. So if it's a very mild issue that you need, we can do fat grafting. If it's more of a significant issue, we can talk about chin implants. But I think they're both fine. Best for double chin, lipo versus non-surgical options. Minor issues, Kybella, non-surgical option. If it's moderate to significant to where you can actually feel it and grab it and you can see it in photos, you're going to need liposuction for that. Is 43 too old for mommy makeover? Absolutely not. I had somebody here ask me earlier if 65 was too old for mommy makeover, and I still said no for that. So 43, not old at all. I think a lot of moms are in their 40s or even their 50s, so you're actually young to be a mom, to be honest with you, nowadays. How much is it? How much is what Mayo wall collection? Do you accept credit cards or cash? Credit cards, no. Credit cards, cash, and financing. We accept all different types. Is there payment plans? Absolutely. So we take care credits, Alpheon, and Patient Fi, but we also take credit cards, crypto, basically anything that's out there we take. And you can split up however you would like. What would you advise for taking care of rhino sutures? Sutures? I mean, I do all my rhinos in a closed fashion. So all my sutures are dissolvable. So there's nothing I need to do for my patients. Again, that's going to be a question for your surgeon because I don't do it the same way as your surgeon does, apparently. What is the cheapest procedure for weight loss? Ozempic. That's the cheapest procedure for weight loss is Ozempic, and doesn't even require surgery. Just injections once a week. Go and diet. Actually, the cheapest option is diet and exercise. If you can diet and exercise, best way. Second best way medically would be Ozempic and Mounjaro. Hello, hi Rosa, thanks for joining. Healthy eating and walking. There you go. Exactly what I was saying. Do you have a scar under your eye so you can get it fixed without cosmetic? If you have a scar under your eye, can you get it fixed without cosmetic surgery? Well, that is cosmetic surgery, right? Because you wanting to improve the appearance of it, right? That's considered cosmetic surgery. Hello, hi Sassy. Recovery time after liposuction, couple days. Liposuction isn't anything very significant. Couple small poke holes. We use a rod to suck fat out. That's about it. Couple days, you should be good to go. Just a range of how much it would be for a makeover run for, like a mommy makeover. The range is like $15,000 to $50,000. I mean, the range is huge only because it depends on exactly what we're doing, right? Are we doing a breast aug and lipo, which is on the smaller side? Are we doing a breast aug, breast lift, lipo, tummy tuck, BBL, and that's going to be on the $50,000 side of things, right? So the range is significant. It's hard to quote a mommy makeover because every procedure is customized for each patient. And so, it just depends on, is it 2 procedures? Is it 5 procedures? It really just depends on what we're doing for you. So we would need to do a consult in order to give you more of an accurate quote. But like I said, anywhere from 15 to 50. How long do you think it would take to recover from it? Abdominoplasty surgery. 2 to 4 weeks. But 2 weeks where you get back to normal daily routine and activities. 4 weeks before you're back to kind of doing everything in your life. Inner thigh lipopricing, probably like I think $5,000 for that. Doc, you're amazing. Thank you for your time and expertise. My pleasure. Thank you for that comment, Rory. Appreciate it. What's the advice for cellulite on thighs? I'm trying to get rid of it forever. Sulfina and Avli are 2 of the best devices out there for cellulite. Happy Wednesday, Sassy. Appreciate that. My fear is getting an infection. That's always a chance. That's always something you have to understand going into, right? Anytime we cut through the skin, it's exposed to the environment. There's always a chance of infection. So it's very rare, but it definitely can happen. Avli, thank you, Diamond. Appreciate that. I need a breast reduction. Recovery time for that, 1 to 2 weeks. I'm 46, but I have an 80-year-old neck. What can I do, sir? You're gonna need a neck lift. You're gonna need a neck lift for that, unfortunately. Do you do consultations? Yes, I do consultations. If you click that link in my link tree above, so in my profile, there's a link tree. If you click on that, there's a link to my actual schedule that you can book right into my platform. So, or you can call my office or email us, but it might be easiest to click that link and you can just put your information in. You'll have a time, you'll get a reminder and everything, and yeah, that's the best way of doing it. Where are you? I'm in Los Angeles and Miami. Inner thigh lipo pricing, I already answered that, $5,000. Have you got any cosmetic surgeries yourself? I have not. I've done Botox, but that's about it. Do you treat international patients, e.g. patients from the UK? I do. Actually, I did a consult with a girl from the Netherlands. I believe it's the Netherlands, yeah. And she's actually coming to see me for her breasts because I think I'm the only person that could do what she's asking for. So yes, I'm actually doing her next month. So yes, I have patients from all over the world. Like I said, I literally talked to somebody last week about a breast dog from the Netherlands, and she booked her case, and I'm doing her next month. Can you do BBL without putting patients to sleep? You got to be asleep for it. Can you look at a video I just posted about my face? I can, but I got a lot of questions here. You're going to have to schedule a consult with me if you want me to do that for you. Forgot a consult. Are you hiring? Not at the moment, Yaya, unfortunately. I have everybody here that I need at the moment. Best thing for smile lines, Botox, it'll be filler. Random, but I'm taking my NCLEX. I'm taking my NCLEX and so nervous. Reschedule twice. Need some good advice, doc. Don't be scared. Just suck it up and take it. The thing about these exams is you can take it again, right? If you don't do well, just take it again. So don't get too nervous. Oftentimes when you're too nervous and overthink, it's actually worse, So just try to relax, try to go in thinking you're going to take it a second time. Don't think about taking it, because this isn't one and done, right? You can always take it a second and third time. So just go in saying, I'm going to take this a second time, and hopefully that'll, bring down your nerves. Asian eyelid surgery for 16-year-old, sure, why not? What can I get done with $6,000? Probably some lipo of the stomach. Is PRP and filler okay versus lower bleph? Yeah, it's okay. They're totally different things. One's non-invasive, one's more invasive. It really depends on what your situation is, Sassy. So PRP and filler can help with volume loss, but a lower bleph can help with bags under the eyes or extra skin. So they do totally different things. Neck lift cost, probably 15 to 20 grand. We're located in Los Angeles, California, and Miami. Would you even recommend a reduction for someone being double D trying to be a B? Yeah, absolutely. Double D to a B, that's 4 cups, right? 3 or 4 cups, absolutely. That's the only way you can do that. Do you do virtual consults? Yes, Wenmo, I do virtual consults. Again, click that link above, and you can schedule a consultation right into my schedule. Hollywood, yes, I'm basically, Hollywood, West Hollywood. Do you have recovery suites for out-of-town patients? We can set you, we don't have it in our particular office, but yes, there are recovery suites that we can get you set up for if that's what you're interested. Yes. Get up TikTok and study for your NCLEX. How often are you in Florida? I haven't lived in NYC, so I'd be easier to go there. I go to Florida once a month. So I'm actually going to be there, not this next week, but the week after. So once a month, I'm there for a whole week. So about a quarter of the time I'm in Florida. I just want to know if you're married. I am not married. I am single and ready to mingle, skincare specialist. Have you done forehead reduction? Yes, I have. They're great procedures. The only thing is you do have a scar that's in the front. If you wear bangs or kind of have your hair like this, you're never going to see it. It actually heals very well also. No, Asians are so handsome and gorgeous. Oh, thank you so much, Katharina Zeta. That made my day. Is it a video consult? We can do video consults. So I see in person and I do video consults just like this. So if you're far away, you're not in LA, or even if you're in LA, I have patients in LA do video consults as well. It's easier for them. They don't have to come into the office. Yes, it's called a virtual consult. So if you click that link above, click the link in my profile and click on the virtual consultation, we can do one just like this. Why does cohesive gel max out at 800? That's all they make. Every silicone gel maxes out at 800 cc's. Recovery suite, yeah, answer that. If you have leg skin removed from weight loss, does it help with crepey skin? Yes, it can. Crap, okay, a lot of questions, so I'm going to answer this more quickly. So any cost questions I'm going to skip only because I'm just going to try to make this more educational. If you have a question about, estimates or anything like that, just DM me, schedule a consult, or call my office. Well, you don't have to schedule a consult if you just want to do get pricing. So just send me a DM. My social media manager is checking it right now, or call my office. The information is above, or you can email me. Any way to get insurance to help with skin removal? Sure. The only thing is a lot of plastic surgeons don't take insurance, so you're gonna have to call your insurance company and get what we call a pre-approval. Once you get a pre-approval, then you'll have an idea if they're gonna cover it or not. How to get wrinkles under your nose? Little Botox. Thoughts on under eye Botox? I think it's great. It helps with what they call the jelly roll here. You only need maybe like 2 or 3 units there. Doctor, how can I become a plastic surgeon right now in LA? It's so hard to find a job in that specialty. It's tough. I mean, plastic surgery RN. LA is actually a little bit tough at the moment. The industry is has been declined a little bit. Even the top guys here are a little bit slow. You just have to find somebody who's willing to take you in. I mean, just keep hitting up spas, keep hitting up clinics, and keep reaching out either on DM or so and ask if anybody's willing to take you in. Do you have or ask your reps? Ask your Allergan or Galderma reps. Do you have recoveries? I already answered that. BBL pricing. I think it's around 18,000. You're absolutely right. Thanks. Also, thanks for answering the question. My pleasure, Tatiana. Hi, I just had gastric bypass surgery. How long would you suggest I wait to have lipo? You have to be weight stable for 6 months. So if it takes you a year to become weight stable, you got to add 6 months after that. So however long it takes for you to lose your weight, add 6 months on top of that, and that's when you can have lipo. Hello, doctor. Do you perform deep plane facelifts? Actually, I do. I think I have one next week or the week after that. So yes, I do. The one I'm doing in a couple weeks is brow, eyes, face, neck. So I'm doing basically the whole face for her. So yes, I do, Bella. If you're interested in a consultation, again, click that link tree in my profile, and we can chat. Do you perform Asian eyelid surgery on 16-year-olds? You have to get your parents to approve it, but yes, I do. But you can't. You're a minor. You have to get your parents to sign off on it. How much is upper and lower bleph? We're probably talking about 12 grand, something like that. 12, around 12 or so. I have dry eyes. Can I get upper bleph? You can. It's not going to affect your dry eyes. Geez, 15 to 20K for the neck. Puffiness under eyes, will Botox help? No, it probably won't help with that. Where in Florida? Miami. In Miami Beach, actually. Mid-Miami Beach. How much for okay, answer that. I got a sister RN. Oh, nice. For lipo, does anyone get a new belly button, or is it in case by case? I'm skinny but I have access. Nobody gets a new belly button with lipo. You only get that with the tummy tuck. Is Gore-Tex or silicone better? For what? The nose? BI. What about BI what, Scotting? Hello, doctor. How much for a full deep plane facelift? Most patients who need a deep plane facelift need a neck lift as well. So if you're doing face and neck, we're probably talking about around 30 grand or so. 25 to 30, I would say. It's crazy how surgeons can be cutting people up like it's a regular day. It's training. I mean, I was in school till I was 32 years old, 32, 33, something like that. So there's no other specialties where you're in school till you're 33. So I didn't skip any years also. So it's from kindergarten, from when I was 5 to 33. I've been training to do this. So this is why it takes so long to go through training. They make sure that you know what you're doing before you get out. That's why board certification is super, super important. If you're not board certified, you're taking a risk. Can international patients pay extra stay in clinic? Yeah, absolutely. We have aftercare facilities that we can get you set up with for your surgery. Where did you do your schooling and residency? Did my residency in Texas. Did my schooling in Florida. Is there any surgeons that can minimize the earlobe? Is there any surgeries that can minimize the ear hole? Yeah, it's an earlobe repair. You can get that fixed. Not really looking for procedures. Just want to say you're very handsome. Oh, thank you very much, Pam. That was very nice of you. It's very flattering. Can laser be used to get rid of melasma? No, you don't want to use lasers on melasma. You want to use a peel. Question: can you have a tummy tuck if you have skin rash? No, the skin rash has to go away before the tummy tuck. Will Zyrtec help with puffiness under the eyes? If the puffiness has to do with allergies, then yes. But if it's not, it won't help. Also, thoughts on lip lift for 30-year-old patient? I think it's great. There's nothing wrong with it. I do them all the time. You can actually do that awake. It's great. Do you recommend doing the scar under the boobs if you have HS skin condition? Well, do you have rashes there? If you have rashes there, I wouldn't recommend it. If you do have it just depends on where you have rashes. Do you have rashes more at the bottom or around the areola? You want to do the scar where you have less rashes, if that makes sense. What do you do with bags under the eyes? There's fat pads that we remove. I hate the fact that we can work out our bodies to improve, but not the face. Yeah, that's unfortunate because working out the face, it tends to droop. Message me back, Leona Doll. Okay, if you DM me, we'll look at your message and I'll message you back. Drawbacks to lipo, really none. There's really no issues with lipo. It's surgery, you have to recover. That's basically about it. I'm interested in before and after pics. What's your website? Jet Setter. Best way, click that link tree above. Go to my before and after Instagram page. I'm working on my website. There's still a lot on there, but the newer ones aren't on there. Social media is more popping than my website, so I've been keeping up with that. So Jet Setter. Click that link tree above. Click my Instagram. It's called Transformation by Tsai. I have 2 Instagrams. I have the main one, and then I have the results page. So look at the results page. All my before and afters on there. I have a ton on there. I try to post a new one every single day up there, so definitely check that out. I have implants, but I think they feel hard. What should you recommend switching to for softer results? You probably have a capsular contracture. It's probably not the implants. You probably have a capsular contracture, so that needs to be treated. Does lipo hurt? Yeah, in surgery. Any surgery hurts, yes. Have you had any procedures, doc? I have had Botox, that's about it, and skincare. Doctor, your skin is glass. Thank you so much. Yes, Pivy, I think a lot of it has to do with genetics. I heard it hurts so much. It does hurt. Liposuction hurts, yes. How much schooling did you do to become what you are today? I was in school till I was 32, 33. Hey, I'm 3 days post-op septal-rhinoplasty. How long till the numbness goes away? Probably at least 2 or 3 months. Gore-Tex or silicone for the nose? I like silicone for the nose. Ooh, gotcha. Okay, I gotta answer these questions a little quicker here. A lot of questions coming in. Does lipo hurt? Yes. Recommendations for 41 with jowling and neck sag starting. You're probably gonna need a facelift by the time you have jowls. Well, how old are you? I am 42. I'm 42. Hey, I'm 3 days post-op septal-rhinoplasty. How long till then? Okay, answer that. Well, that sounds doable for me. Great. Well, I answer that. Less invasive alternative to the facelifts. Threads. How painful is tummy tuck? It can be painful. It's a big procedure. We're cutting out a large chunk of skin, so it can be painful, yes. We're in Texas. My husband did residency. Oh, nice. I did my residency at UTMB in Galveston, just outside of Houston. My Houston method is great. I've spent some time there as well, and that's great. Can you reduce the size of a tongue? You can, but I don't do those. Does lipo hurt a lot? It depends on your definition of a lot. Some patients, they're okay with it. Some patients are not okay with it. Best non-surgical thing to use for firming neck. Threads and radio frequency devices. How many surgeries do you perform a day? It depends on the surgery. Like I said, if you were here 5 minutes ago, I have one surgery that's, I don't know, the brow, the eyes, the face, the neck, and some fat transfer. That's only one big surgery, so I can only do that in a day. But I'm doing multiple different small things within that surgery. So it really just depends. You have to be 6 hours or less, but it just depends on how long it takes to do the procedures. Is there any treatment for stretch marks? There are some lasers, but they don't work very, very well. Where are you located? I'm in Los Angeles and Miami. What about big arms? Is there arm lipo? I'm down 67 pounds, but my arms never changed. If you're down 67 pounds, you probably have excessive skin. You're gonna need an arm lift. You can't do arm lipo, but arm lipo only takes care of volume, not skin. So if you have skin, which I assume it's more skin, if you're down 67 pounds, you're gonna need an arm lift. What state are you in? I'm in California and Florida. So Los Angeles and Miami. I'm actually loving this actually. Oh, great. I'm glad you guys are enjoying this. Are you looking for a surgical tech? Not at the moment, Soraya. We're good for now. I want to close my earlobe piercing. Do plastic surgeons do that? How much would it cost? Plastic surgeons do that. It's probably about $1,000, I assume. Do you do surgery on diabetes? What A1C do you want? Yes, we can do surgery on diabetics, but your A1C and your sugars have to be in the normal range. whatever that normal range is. I can't remember, is it 5 or 4, whatever it is, you have to be that or below. Can you fix, can you fix, wow, a lot of, okay, I'm gonna answer these a little quicker. Does semaglutide cause hair loss? It shouldn't, but at the same time, a lot of patients don't eat normally, and so they're obviously malnourished. So, you know, yeah, obviously that has to do with, you know, your nutrition. So, for example, you're probably not getting enough protein in if you're doing semaglutide, right? So you gotta make sure you get the protein, enough protein in, or enough nutrients in. People still eat like shit when they're on semaglutide. So imagine, you know, obviously you're gonna have nutritional issues because you're not even getting the calories you need in. Can you fix one droopy eyelid, or does both need to be done? You can just do the one. I love that you're answering people's questions very authentic. Love that you're being approachable. Thank you so much, Shane. I appreciate that. That's very nice. That's why I do this. I think you know, I want to be open and honest with everybody and give you all the information you need, you know, for your own knowledge. Do you take call at hospital after residency, or did you go straight in? I went straight into private practice personally. Where are you located? Los Angeles and Miami. How do you feel about stomach sleep? I think that's a great procedure, but now with the Ozempic and things out there, I think those are better procedures because it's non-invasive, right? And it works very, very well. Stomach sleep, there's a lot of complications. Excuse me, a lot of complications, and it's a big surgery. So, you know, I'm not a huge fan of it. What do you surgery on diabetics? Okay, I answered that. Do you take Botox or just skincare? I do Botox and I do skincare. Yes. Can Renuvion be done alone? I already had lipo BMI 19. Yes, Renuvion can be done alone. What is threads? They're basically sutures that go into the face to pull the skin up. Arm lipo or arm lift? Depends. If you have fat, for lipo. If you have skin, lift. If you have fat and skin, you need lipo and lift. I just know your parents are proud. Oh, thank you so much. I appreciate that. What do you specialize in? A little bit of everything, but mainly I'm known for my noses and breasts. Is age 62 for rhinoplasty? Absolutely not. You're still young. As long as you're healthy, no medical issues, you can absolutely still get a rhinoplasty at 60. Thoughts on cancer treatments like chemo? I don't know much about that. Again, I'm a cosmetic surgeon, so I'm going to steer clear away from that because I don't have any knowledge about that. Can you perform a makeover and arm skin reduction during the same surgery? Absolutely, yes, yes. What do you think about the at-home red light therapy devices? I think it's great. You know, obviously there's different, you know, medical grade, regular grade. They're not all good, right? You got to make sure it's probably like a medical grade one that definitely has some, you know, benefit from it. It's not all red light or gray, right? So make sure you get a medical grade one. Does 10% body fat have enough for fat grafting to be under the eyes? Yeah, you don't need a lot of fat. Everybody has enough fat for fat grafting under the eyes. What is the cost in tandem to do a lift? What kind of lift? Like an eye lift? Is it upper or lower? You know, if you're doing upper and lower eyelids and fat grafting, we're probably talking 12 to 15,000, something like that. Both skin and fat, it's crazy that they're just big. Yeah, sometimes it happens. Facelift after sculpture, absolutely, you can do that. Does lipo take away fat and slim inner thigh fat? It can, yeah, that's the whole point. Have a great day. Thanks, Pam. You too. Mastopexy reduction with lift. What about it depends on what you need, Megan. If you want smaller breasts, you need a reduction. If you only need a lift, then you just need a mastopexy. So you get a lift with a reduction anyways. Thank you for allowing people to be more... I need to answer these quicker. Sorry, I'm going to start skipping some questions here because I can't get to them all here. Thank you for allowing people to be more confident after your hands blessed. My pleasure, Catherine. Thanks. I appreciate that. Thoughts on double chin surgery like the lipo they do? I think it's great. Advice from the last month: does it respond to topicals? You got to talk to a dermatologist about that. You're in Miami? Yes. 1 week in Miami, 3 weeks in LA at the moment. But I am in Miami once a month, yes. Face, answer that. How much for lift with implants in Miami? 15 to 18,000. Best procedure for hollow dark circles. You need to talk to a dermatologist about that. Doc, I missed the answer. Sorry about gaining and losing weight after lipo. Way to go back to how it was. You want to keep the same. If you gain weight, you're going to get bigger. If you lose weight, you're going to get smaller, I guess. I'm not sure what I was mentioning back there, but you want to maintain your same dietary and exercise habits, or else the surgery is not going to look the same. Are you single? Yes, I'm single, Celeste. Does PRP for under eyes actually work, or a waste of money? It works, definitely. I like you. You have great energy and very intelligent. Thank you very much, Michelle. Appreciate that. That was very nice. Appreciate the words. Why can't you do lipo on the stomach at the same time as the tummy tuck? You can. I do them all the time. I don't know who said you can't. You can, absolutely. Can you do lipo on the mons? Yes, absolutely. Do nurses get discounts for procedures? They don't, but if you do multiple procedures, I can probably help you out. Bless you, bless you. Oh, thank you so much. Appreciate that. Bless you. Wow, I got 3 bless you. Oh, the sneeze. That was a while. Wow, I have a lot of questions to catch up on. Wow, that's a bless. A while back. um, what sutures do you use when closing skin on tummy tucks? I use permanent ones for the fascia and dissolvable ones for the skin. How much water do you drink a day? Not enough, but I have it right here. What do you do first? Lipo in the back or the tummy tuck, or do separate surgery? I do all the lipo first and then do a tummy tuck, but you can do it at the same time. What brand skincare do you use? Epicutis. Good morning, doctor from Thailand. Oh, good morning. Thanks for joining. How do you handle device reps? What makes you excited about new technologies? I listen to what they say and I see if it makes any sense, and then I see the research. I see the research and the data on it, and then I kind of make my mind on if it works or not. What's the recovery time for upper bleph? A couple of days, and that can actually even be done awake. How long is thread recovery? Cost for gels? I don't do threads. I just know about it, but there's no recovery for it. The same day you're back to everything you're doing before. Is it true that insurance will pay for certain stomach fat removal? Not for stomach fat removal, for skin removal, maybe they can. What a hunk. Oh, thank you so much, Meows. Does lipo tone your inner thighs? No. If anything, it might loosen it some more. What do you do first? Answer that. For rhino, if I just want my nose bridged, bone straightened, would it be cheaper versus the tip alone? Not necessarily, because when you straighten the nose, it can widen out, and you might have to break the bones in order to narrow it. You might have to actually break the bones in order to straighten it out as well. So, no, it's usually not cheaper. The tip is usually cheaper. The bridge is usually more expensive. Do you do fillers in Miami? Yes, I do fillers in Miami. Yes. What do you do first? I answered that. How do you fix crepey eyelids? Surgery, unfortunately. I have fibrosis after lipo. Can I get more lipo where the fat came out? You can. It just depends. Do you have lumps and bumps already? If you do, you probably can't. But if you still have some fat remaining, absolutely, you can. Is abdominal repair? Ooh. Wow, okay. Is abdominal repair with hernia covered by insurance? The hernia is, but I'm not sure what you mean by abdominal repair. What's the best way to treat minor lipedema of the upper arms? Liposuction. Appreciate straightforward Q&A. Thank you, Darren. I have a lot of questions here, so I'm trying to hit everybody just to make sure that I maximize the results here. With a full facelift, also do my eyes and neck. Yes, you can do it at the same time. Lost 85 pounds with sleeve, all been great. Need to remove skin. Can thighs, belly, and arms be done at the same time? Depends on how big it is. The surgery has to be within 6 hours, okay? So if the surgeon can do it within 6 hours, absolutely. If the surgeon feels like it takes more than that, you might have to separate it. Thoughts on 360 tummy tuck? I think it's great. I do it all the time. If you click the link tree above and click my before and after Instagram page, you'll see that I do a ton of those. You can see my before and afters. I think it's a great procedure. Are risks higher on a second BBL, or is it the same? It's the same. Best thing for acne scars, CO2 laser. What do you think of plastic surgery in Turkey? I think anywhere you go, there's going to be good and bad surgeons. So you just have to do your own research. Advice for someone starting out practicing plastic surgery, recent med school grad. Best of luck. Get your Instagram and social media going like I did. That's the best way of moving forward. Social media is so huge nowadays. It's all about marketing. It's all about marketing. Get that going. Start doing some cases. Start off with Botox and fillers. Work your way up. How many facelifts can you have in one month? As many as you want. How much for a tummy tuck? 12 to 15 grand. Can you do rhinoplasty and facelift at the same time? Yes, absolutely. I do it all the time, actually. Will a full facelift also cover my eyes and neck? No. Neck lift, facelift, totally different. Eyes, totally different. You can do all at the same time, but they're different procedures. For rhinoplasty, if I want my nose, I answered that. How much for chin, lipo, and Miami? Awake or asleep? If you're doing awake, probably 3 or 4 grand. If you do asleep, probably 4 or 5 grand. Free consultations, virtual ones, yes. Hello, is sculpture okay? Yes, sculpture is fine. Do you mentor med students interested in plastic surgery? I can't do med students because we don't have the ability to do that here because of the private nature of our patients. Cost for explant with replacement and pocket tighten. Cost for explant with replacement. About 15 grand or so, I would say. Are thread procedures worth it if cost is an issue? I don't do thread, so I really can't tell you. I just know that's a secondary non-surgical procedure. I do more surgery, so I can answer surgery procedures, but non-invasive stuff, you're gonna have to talk to more of non-invasive providers like dermatologists and nurse injectors. Did a tummy tuck in January 25 did not do no muscle repair and said it's not always needed. Thoughts? It's not always needed, that's true, but 99% of the time it is. So you just have to talk to your surgeon about that. And you already had it done, so it's too late now anyways. Which is better, lipo and mons or monsplasty? It depends on the situation. If you have fat, lipo. If you have skin, monsplasty. If you have fat and skin, it's lipo and you have to do both. Oftentimes it's not one or the other. Oftentimes it's both. Can you do a reverse BBL? Yes, you can suck the fat out, absolutely. How long does lipo hurt for? A few days. Um, okay, just got resets. Here we go. So what does lip exactly do then? I don't know what you mean by lip. Is there such thing as a mini facelift? Not necessarily. You kind of just need the whole thing. What's the recovery time for? I don't know anything about cleft. I mean, I used to do cleft palates, but I don't do them anymore. Do you do HS surgery? Hydrinitis? No, I don't. Facelift cost in Miami, it's the same thing, about 25 to 30 grand. I have no lumps and bumps on my stomach. It's flat where my fibrosis is, and fat around is very soft. So you could probably get another session of lipo, Nikki. I am 5 months post-op tummy tuck BBO. When can I begin to wear stage 3 faja? I think you could do it now. I would talk to your surgeon though. Any procedures for cellulite? Sulfina and Avali. Does your office have experience with gender-affirming care surgeries that go through insurance? I don't do any surgeries. I'm sorry, I don't do any insurance at all. I do some gender-affirming procedures, but none of it goes through insurance. Have a great day. I'm back in school in 2 years, clean, losing weight. Hope to earn money surgery. Amazing. Congrats, Michelle. Best of luck with school. Thoughts on angled jaw implants? I don't do them. I've talked to a lot of colleagues that do all facial surgeries, and they don't recommend them either. It's something, it seems that it's not very recommended to do. Do people ever come from out of state to have you do surgery? And if so, what is the length of time for rhinoplasty and aftercare? Very good question. A lot of my patients from out of state, I would say maybe 10 to 20% are from out of state. In fact, I was just talking, I have a patient coming from out of the country even to see me next month to have her breast augmentation done. So I have patients from out of the country even coming to see me to do that. So yes, I would say stay in town for about a week because we need to take the splint off a week later, and then you can go home. Can working out help with small amounts of loose skin in the abdomen? Loose skin cannot be worked out. The only thing working out helps with is toning of the muscles so it can thicken it out and reduction of fat. You can't work out skin, unfortunately. How much on lipo for inner thighs? I think like 5 grand. Upper bleph price? I think it's 4 or 5 grand for upper bleph. Do you do sleeves? I don't. Hi, the procedure for thigh shape, no skinny. I don't know what you mean by that. Is there a surgery for my nose so it's not so wide towards the nostrils? Yes, it's called an ala reduction. I actually just did one of those yesterday. You can actually even do those awake. So I actually literally just did one yesterday. Can a lip lift be done without horizontal long lip scar result? You can't. A lip lift, anytime you do a lift, you're cutting out skin. When you cut out skin, you're gonna need to create a scar somewhere. So anytime you do a lift, there's always gonna be some excessive scarring. So unfortunately not. How do I research a doctor? Just like you're doing now, go to their social media, look at what they post, look at their Instagram page, look at their website, look at their reviews. I mean, that's all you can really do. What is your rhinoplasty revision rate? Once a year. I hardly have any revisions, to be honest with you. Like less than 1%, I would say. Less than 1%, which is kind of crazy. Yeah, I'm a little shocked. I'm not trying to brag. I'm a little shocked, but less than 1%. I mean, I can count on one hand. I've done more than 1,000 rhinoplasties, and I can count on one hand that I've had to do revisions on. Probably like 3 out of the more than 1,000 that I've done. So it's like, what's that, 0.003? It's not even close to 1%. So very, very, very rare. Hello, doctor. Where are you located? I'm in Los Angeles and Miami. How far are you booked out? 1 month. Do you do gastric sleeves? I don't. Where are you located? I'm in Los Angeles and Miami. How much is a rhinoplasty? 15 grand. If there's fat in the midsection, will a tummy tuck work? Yeah, absolutely. Do you do the gastric sleeve? I don't do the gastric sleeve. Do you recommend Motiva implants? Not at the moment. Can I get a tummy tuck after ALIF? Yeah, absolutely, as long as you get cleared for it. How far? Answer that. Awesome, thank you. My pleasure, Mickey. Is milk bad for you? I have no idea. I don't think so. Hi, how are you? I'm great, thank you. If there's, answer that. Thoughts on chin Botox? I think, if it crinkles there, sure, I think it works. Why is your rhinoplasty, what? I already answered that. Revision rate. Why is the abdominal hard after lipo and tummy tuck? Scar tissue. Do you answer that? If I had implant exchange to a bigger size, do you recommend pocket work? Sometimes it depends on how big you're looking to go. Hi, where are you located? Los Angeles and Miami. Why is the abdomen? I answered that. Can an extreme lift be done without a no, you can't. You need that horizontal scar. I already answered that. How about skinny BBL? Absolutely, I do them all the time. I think it's great. Is there a surgery to correct the horizontal line on the abdomen? I'm not overweight thinking it's muscle. I'd have to take a look at you to see what you're talking about. It's hard to say. I'm scared to do tummy tuck, but I know I need it. But will I keloid? If you tend to keloid, there's obviously a possibility of keloiding, yes. Is there no surgery just for the tip and the nostrils? Yes, it's called a tip plasty. and alar reduction. Can you give meds for lipo pain? Absolutely. I give every lipo patient pain meds, yes. Does one have to wait until having kids before getting a mini tummy tuck? No, you can get a mini tummy tuck now if you like. What's it different? What's the downtime for transfer to the breast? A couple days, a week at the most. Okay. How much is for rhinoplasty? 15 grand. Do you like lip lift results? Yeah, I think it's great for the right patient. Yeah. I have, if since you're on TikTok, if you gotta scroll maybe 2 or 3 years back, but I posted a TikTok for a patient and the procedure itself if you want to scroll back and take a look at that. Do you ever reject patients from what they want? Yeah, I do it all the time. If what they're asking for is not consistent with what we can do from a plastic surgery standpoint, yeah, I reject patients. Why is the answer? That's scar tissue. Lipo for the underbelly. I'm thin and work out, but I can't get rid of the lower belly fat. Yeah, you could do lipo there. Like it's like a localized area that we could do liposuction on. When 2 weeks post-op, arm lipo and swelling in the back of my arms is firm. Normal. You're gonna be swollen for months. Good luck with 2 weeks. I tell patients you're gonna be swollen for 6 months. So you're not even close to being done with that. Do you recommend buffalo hump removal? Lipo, sure, yeah, absolutely. Why is the abdomen hard after lipo? And tummy tuck, I already answered that. It's scar tissue. Thoughts? What weight loss surgery do you do? How much? I don't do weight loss surgery. What about skinny beef? I do that, yes. What is the pros and cons of surgical residency? I think it's, it's tough to get through, but if that's what you want to do, you have no choice. I don't really think there's pros and cons. Like if that's what you want to do, you just got to suck it up and do it. How much can tummy tuck run? 12 to 15 grand. When do you recommend someone to stop smoking before surgery? 2 to 4 weeks before and afterwards, depending on the procedure. How much for a skinny BBL? 12 to 15,000. Do you reject? I answered that. Doc, I've gained 30 pounds in 2 years. Help. Diet and exercise, man. Diet and exercise. Can I do surgery for my lower belly fat? And how much? Yes. Like I said, about 5 grand for lipo. Do you have a girlfriend? No, not at the moment. Cause of temporal implants? I don't do temporal implants. Can you do surgery on a patient with Ehlers-Danlos? You can, depending on the procedure. Thank you. My pleasure, Mindy. Sorry, I'm just going quicker because I'm trying to get through everybody's questions. What's recovery for lipo? A couple days to a week at the most. What inspired you to work in plastics? I like the variety of it. So I wanted to work with my hands and I like the artistic aspect of it. So yeah. Do you have a girlfriend? No, not at the moment. Great job answering so many questions. Thank you so much, Cindy. What's better, lipo or tummy tuck? It's not either or. Sometimes you need both. 90% of the time you need both. If you have volume, if you have fat, lipo. If you have skin, tummy tuck. If you have fat and skin, you need lipo and a tummy tuck. Face of how much? About 25 to 30 grand. How much is for BBL? 15 to 18 grand. Answer that. What do you do for keloid scars that form post-punch biopsy? You can cut it out or maybe do lasers. Where do you start for evaluation? You need a consultation. So Sylvia, click that link tree above in my profile. And there's a link within the link tree to schedule a consult with me, so you can see me in person or you can schedule a virtual consultation for me. Do you do calf augmentation? I can do, I do fat grafting, yes. Are you located in New Jersey? No, I'm in Los Angeles and Miami. How much is rhinoplasty? 15 grand. Do most surgeons have experience using tissue expanders in the arm for hemangioma? No, most surgeons don't. You have to go see a reconstructive surgeon. Explain non-surgical BBLs. Filler. Basically, just take filler and inject it. That's all it really is. Just like you put fillers in your face, you just put fillers in your butt. That's all it really is. Whichever data patients, it's got to be past the recovery period or past the what do you call it, the treatment period. So potentially, but not during, I think it has to be like 6 months or a year. Oh, it's 2 o'clock. I do have to go. Okay, I do have a patient at 2 o'clock. I'm sorry. I actually have a virtual consultation at 2 that I have to get to. So I do have to leave. I'm in Miami Beach, mid-Miami Beach. So I'm sorry if I didn't get to your questions. I try to get through as many as I can. I'm sorry if I talked a little too quickly, but I wanted to at least cover and shotgun this approach and maybe get to as many questions as I could. So if you guys have any further questions, just send me a DM. I'll try to answer as many DMs as I can. I do this every Wednesday from 1 to 2 o'clock. So you can also join me next Wednesday from 1 to 2. Also, like I said, send me a direct message. I'll be happy to get with you and answer your questions. Additionally, if you guys are interested in doing a procedure with me, click that link tree in my profile. click on the schedule a consultation with me. I could do a virtual. Again, I'm doing this in like a minute. Literally, I have one at 2 o'clock. So we could do a virtual consultation or an in-person consultation. So thank you guys. I mean, this was very, very robust. I mean, it was a very, very good live. I appreciate all of you joining and answering your questions. But again, sorry if I missed the last few questions, but I do have to go. Again, send me a DM or let's chat and have consultations. I do virtual, we're doing complimentary virtual consultations at the moment. So if you're interested in chatting a little bit more about your case, more than welcome to do that. So again, click on the link tree in my profile and we can chat some more, okay? Thank you all for joining. Have a wonderful and blessed week. We will see you all soon. God damn. Gosh damn.